Okay, here is my consent form. Jay, do you consent to being in my video?
Yes.
It's my 360. Okay. Here is my ID. Okay, so the first thing that I am going to do is log into my patient's EMR. So once I do this, I'm going to select the patient list and select the correct patient, and I'm selecting Michael Head. Then I'm going to review the medications ordered, any kinds of allergies and dietary restrictions or recommendations. So I'm administering lisinopril. It is for blood pressure. His blood pressure was 176 this morning, so this would be a good, this medication is still good to give. There are no dietary restrictions or recommendations to give with this medication, so I will be giving it with water. Okay, so now I'm going to log into my AccuDose. So I'm going to click the correct medication, and then I am going to do my 6 patient rights. So first I start off, I do see the allergies still. Both allergies of sulfa is the same on both the AccuDose as well as the EMR. So I have Michael Head here in the EMR, Michael Head in the AccuDose. I have lisinopril, which is the medication I am administering, and lisinopril on the AccuDose. It is a 10 milligram dose, 10 milligram dose. This says the route is oral, and this says it is a tab, which I know can be given the oral route. I accidentally switched slides. I do see that this time due is 11 o'clock. Says 11 o'clock. It is 10:45, so this is within the range that I can administer the medication, which is an hour before the time due or an hour after, so I can administer this anywhere from 10 to 12 o'clock. So those are the 5. So the 6th one will be documentation, which I will do when I administer the medication. I will document whether he refused the medication or if he took it correctly. So now I've done the 6 patient rights. I have selected the correct medication. So I can go ahead and administer or dispense the medication, which I will just check the packaging, a few things, make sure it is the correct medication, which this says lisinopril. It is a 10 milligram dose. The packaging is all intact, and the expiration date isn't till 12/22, so it is still able to give to the patient. So now I will just log out of my AccuDose so nobody can use the system under my name, and then I will also log out of the EMR. I will obtain my supplies I need to administer the medication. So I need a medicine cup, my scanner, and the medication, and the patient has water in their room. So now I will move to the correct patient bedside. So now that I'm at the patient's bedside, before I enter the room, I will make sure to wash my hands. I'm going to introduce myself. So I'm Cami. I'm going to be your nursing student today. Can I have your name and your date of birth, please?
Michael Head, 4/24/1944.
Okay, and then I'm going to scan his wristband. Beep, beep. And I'm going to log into my EMR. So I do, the information he gave me does match the EMR. And then I'm going to explain the procedure. I'm going to be giving you your 11 o'clock medications today. I'm giving you lisinopril, which is for your blood pressure. So I would check his blood pressure and make sure that it's still in the range that I would administer this medication, which it is. And then at this time, if I did need to adjust the dosage of the medication, I would do so in the EMR. But this is a 10 milligram tab, and I need a 10 milligram dose, so we are good to go. So I do again see his wristband for the allergy to sulfa, which is documented in the EMR. So now that everything matches up, his allergy, his name, the medication, I don't need to adjust the dosage. I can go ahead and do my 6 patient rights again. So his name is Michael Head, according to his wristband and information he gave me, which matches the EMR. I'm giving him lisinopril, which it matches the EMR, a 10 milligram dose, 10 milligram dose. It is the oral route. This is a tab, so it can be done in the oral route. And it is about 11 o'clock now, which is the time that it is due. So we're in the time range to administer this medication. So now I am going to select the Admin RX tab. I'm going to go to the to-do list and select the correct medication. So I'm going to scan his wristband and the medication. And again, this is when I would adjust the dosage if need be, but it is 10 milligrams and it matches the EMR. So now I scanned his wristband, I scanned the medication, so I can go ahead and administer the medication. So I'm going to open it up. And this is when my 6th patient right will come into account. So I will observe him taking this medication. Okay, so the patient did take the medication properly. He did not refuse it. So I would document that in my EMR. So I would document that, and I would also document the time that it was given, which is 11 o'clock. And then I would go ahead and I would scan my badge. And then I would go ahead and log out of my EMR. Then I would just make sure that my patient is positioned for comfort, side rails up ×2, the call light and belongings are within reach, and the bed is in lowest position, and make sure to document my findings in the EMR.